Welcome to another episode of the Foot Geekz. My name is CJ, and today with me is Dr. Kody Au from Baseline Chiropractic. And today we'd like to address a common issue that we see in quite a number of patients of ours, and that Dr. Kody Au sees a lot in his patients as well, and that's osteoarthritis. Now that can present itself in many different joints of your body. It could be in the big toe joint, it could be in your knees, it could be in your hips, it could be in your back. But let's have you take it over and let's talk about some of the different treatment modalities that can help improve pain.
Thanks. So osteoarthritis, or degenerative joint disease, as it's known for some people, is something that is very common. It's probably the most common condition out there as we start aging. I think a lot of people have heard from their doctors or something like that you have degeneration. You're degenerating. It's just the way it's going to be. I don't think that degeneration is usually that huge of a problem. It is a natural part of life. Things, as you move more and you get older, yes, they start degenerating, but it doesn't have to be debilitating. My thing is, degeneration does not have to equal pain. It can, but it doesn't have to. And so we have to kind of exhaust our different methods to try to see if we can fix it or even lessen it. Okay, so it doesn't have to be the extremes that you're experiencing. With a lot of joints, why does the body even degenerate the way it does, right? We hear terms of bone spurs. We hear, things like flattening discs. We see things like, misalignment, everything like that come with it. Why does it happen? It's actually our body's way of adapting to stresses. So as we get older, we know that our ligaments, our tendons start to deteriorate. They get a little weaker. So therefore, we have more mobility in those areas that should be more stable. So like your spine or your knees or weight-bearing joints typically. So when that happens and they start deteriorating, our brain basically says, oh, something's going on. Let's try to lock this down. Let's give it more stability when there's too much mobility now. So it adds bone. If you have calcium in your body, it keeps adding bone, and it causes those spurs that eventually are trying to take over the joint, your ligaments and your tendons that are around it. So if you actually see it, it actually starts kind of ballooning and giving you that extra shape so that it stabilizes it. If it compresses some tissues, yes, it can hurt. But oftentimes when it's first starting, the biggest thing is to keep that mobility, keep everything moving, retrain stability with your ligaments and tendons and balance and everything like that so that it deters this. With a lot of those weight-bearing joints, we actually experience, we think that, oh, I'm never going to walk again, or walking is going to be terrible for the rest of my life. I've seen a lot of people that we can start doing different modalities of laser is one of them. Cold laser therapy has been very effective in kind of decreasing the arthritic kind of conditions as well as the inflammation that's due to it. Manipulation of those areas. I know.
So laser, can you actually break up the bone?
No.
No, it doesn't do that?
No. The laser is more of a light therapy that's designed to work with your tissues. So it activates special cells special organelles inside cells, which are called mitochondria. So the mitochondria are power generating cells. And so they're the ones that keep everything going. And as you age, the mitochondria kind of slow down. And so it's trying to promote more, therefore you can generate more nutrients and take out waste. And that's how it works, and so it's really good in decreasing the degenerative joint disease inflammation that you're getting as things are wearing down. So I think as laser, that's how it works.
Okay.
Whereas I know a lot of questions come with chiropractic as I'm older, chiropractic cracking, everything like that. I'm scared because you might break a bone or something like that. Yeah. It's very safe, granted that we take a full history. Okay, so I take a full history to make sure that I know what kind of conditions they're working with. Do they have osteoporosis? Do they have problems with their bones? Do they have stuff like that? Because there's different methods that we can take to allow for relief without being as aggressive as some have experienced or seen. The adjustment doesn't have to necessarily make noise or anything like that. We're trying to generate motion. So I use different variety of tools. So if it's in the foot, I can use things like the speeder board that allow for gravity assisted motion to push into those joints and allow for something to happen and generate motion. In the back, in my office, I have tables. I have different tools to assist with those, so that doesn't allow for those to happen.
So osteoporosis, I mean, would you say, no, not really a concern? Would that be more gentle therapy when it comes to chiropractic?
Typically, when I hear osteoporotic, or even as people are aging, I typically ask the questions to see if they've had testing and everything like that, so that mistakes don't happen, right? If knowledge is left out and we just assume, it's going to make a problem for both of us. So why not be more conservative, work through those problems? Sometimes, honestly, coming to a chiropractor, which is weird, you may not even get adjusted. If I don't feel that your joint has any problems, then we're working on muscles. We're working on stability training. We're working on different things to try to get you back to where it is. I don't need to crack to make myself happy. I need you to get better. That's what makes me happiest at the end of the day.
And I think strengthening exercises are huge. I mean, I find those very effective when it comes to arthritis, in the knee especially.
Exactly.
You know, just working on quad strengthening exercises to help stabilize the knee joint, which, as Kody was saying, if the ligaments aren't there to stabilize it, you need to have the muscles take over. And if you don't work on those on a regular basis, and it doesn't have to be, don't have to be like Arnold Schwarzenegger doing, 300-pound squats and stuff like that, right? I mean, that's not what we're talking about here. It's more usually weight-bearing exercises where, using body weight to engage those muscles more substantially. And I think, the common mistake is, many, as we age, that, we feel, oh, well, I walk, 5-10 kilometers a day, which is great. That's fantastic. Don't get me wrong. I mean, we want to have the cardiovascular health as well, but it doesn't necessarily have the same benefit as a strength training routine. I mean, correct me if I'm wrong, but those are usually the things that I would recommend as well.
I think strength training is a great aspect. I think one thing that's usually left out is also balance training. As we get older, our balance deteriorates, partially because the ligaments, the proprioception or joint space where your joint is deteriorating in your foot, in your knees, in your hips, even in your brain, really. And so new studies have actually shown that Tai Chi has been one of the most effective exercises in preventing falls for the elderly, preventing broken bones, because one of the biggest things that plague our Medicare system is broken hips, right? Someone falls and they're 70 years old and they break a hip, chances are, like, the statistics aren't great. 50% of those people will never return home. May it be they never leave the hospital, or may it be they end up in long-term care homes. Our job as practitioners is to prevent that, to allow that never to happen. And so balance training, strength training, as Christian was saying, is essential for long-term health and quality of health, right? We are in a society now that we live longer. But does that mean we live healthier? It's an argument that I would say no. Like, we live longer, but most people aren't that healthy nowadays. So let's do things to try to promote that for you.
Fantastic. I agree with you completely. If you have balance issues, oftentimes shoes can help with that as well. Obviously, if you choose a sensible footwear with a broad base, not too heavy necessarily, but also having potentially a rocker profile in the front to prevent, increased flexion at the toe joint, which can cause pain. If there is pain, we try to mitigate that as much as possible. But, there's other things you can do to improve that as well. I mean, if there is, let's say there's an arthritic joint condition where the big toe doesn't move up and down, do you find that, you can actually make that more mobile with chiropractic treatment over time?
Definitely. I think over time we can definitely make it work. The only time that it won't work is if that degeneration has to the point, like I was saying, of balloons. It can get to the point where it completely solidifies with bone.
Yeah.
And when that time happens, that's when I refer to Christian. Because you're going to need some assist to help you out. And something like exactly what he said, a rocker bottom shoe, something to decrease the amount of range that you're required there is something that we can work. And sometimes it's just exercises. I will give simple exercises to try to increase that range of motion yourself.
Yeah.
Because I think that I see a person for half an hour a day, maybe 3 times a week if it's really intense. But there's 23 and a half hours in a day that you are on your own. So I need to teach you how to figure things out yourself as well.
Excellent.
Yeah. So there we go.
If you have any more questions, please post them below. We're more than happy to answer any of those questions. Do check out Baseline Chiropractic. There's a link down below. Do like us on YouTube or our other social media channels. Thanks for watching.
Yeah, see you next time.